Subscribe for clear, no-fluff health info for seniors. Let's get right to it. If you're over 60 and have experienced any of these 5 symptoms, you may have been told it's just aging. But in many cases, these normal signs of growing older may actually be early warnings of something much more serious. Here are 5 symptoms that are often dismissed, but shouldn't be. 1. Dizziness or lightheadedness. Common? Yes. But this could point to low blood pressure, inner ear dysfunction, or even early signs of a mini-stroke. 2. Memory lapses or forgetfulness. Many seniors chalk this up to senior moments. But recurring forgetfulness can be a red flag for medication side effects, thyroid issues, or even vascular dementia. 3. Excessive fatigue, even after rest. Feeling tired now and then is normal, but fatigue that doesn't improve with sleep could signal anemia, sleep apnea, or heart problems. 5th. Frequent urination at night. Waking up to pee once or twice might seem typical, but more frequent trips could be a sign of uncontrolled blood sugar, prostate issues, or even congestive heart failure. 5. Loss of balance or unsteadiness. It's easy to blame this on weak legs or aging joints, but balance issues can indicate neurological problems or even small silent strokes. If you've experienced any of these, don't just assume they're part of getting older. They could be your body's way of trying to get your attention before something more serious develops. Next, we'll go through each symptom one by one and explain what it might really mean, why seniors are especially at risk, and how to take action before it becomes a bigger issue. Let's start with the first symptom. 1. Dizziness or lightheadedness. It might happen when you stand up too quickly. Maybe it hits you when you get out of bed in the morning. It passes after a few seconds, so you shrug it off. But if it's happening regularly, you need to pay attention. In seniors, dizziness is often caused by orthostatic hypotension, a drop in blood pressure when standing. This may be due to dehydration, medication side effects, or poor circulation. And it increases the risk of falls, which can be life-altering in older adults. But it can also be something more serious. Inner ear problems, such as benign paroxysmal positional vertigo, BPPV, can cause dizziness and increase fall risk. These aren't always obvious. You might not feel spinning, just a general instability. And in some cases, dizziness can be a sign of transient ischemic attacks, or mini-strokes. These often go undiagnosed because the symptoms are mild and temporary, but they're often a warning that a larger stroke may be coming. If dizziness happens frequently, especially when you're not dehydrated or overheated, talk to your doctor. They can check your blood pressure in different positions, review your medications, and rule out more serious causes. Next, let's move to something that concerns nearly every senior at some point. 2. Memory lapses or forgetfulness. Misplacing your glasses, walking into a room and forgetting why? These are so common they become jokes. But memory loss isn't always harmless. If you or someone close to you starts forgetting appointments, names, or conversations regularly, it may not be just aging. It could be medication side effects, particularly from anticholinergic drugs, sleep aids, or anxiety medications. Vitamin B12 deficiency, which is more common in seniors and directly affects brain function. Thyroid dysfunction, which can cause brain fog and memory problems. Or early signs of mild cognitive impairment or vascular dementia, especially if paired with other symptoms like confusion, trouble concentrating, or word-finding difficulty. One of the most important things to look for is progression. Are the lapses getting more frequent? Are they interfering with daily life? If so, it's time to take it seriously. There are many treatable causes of memory problems, and catching them early is often the key to slowing or reversing the decline. In the next section, we'll dive into one of the most common and most misunderstood symptoms seniors report: fatigue. Let's keep going. Let's talk about one of the most frequently overlooked symptoms in seniors. 3. Excessive fatigue, even after rest. We all feel tired from time to time, but if you're getting a full night's sleep and still waking up drained, or if you find yourself constantly needing naps, dragging through the day, or struggling to finish basic tasks, something else may be going on. Here are some of the most common and serious causes of unexplained fatigue in older adults. Anemia. As we age, anemia becomes more common, especially due to low iron, B12, or chronic disease. If your red blood cells aren't carrying enough oxygen, everything becomes harder, including thinking, walking, and even eating. Fatigue is usually the first sign. Sleep apnea. Many seniors live with undiagnosed sleep apnea, where breathing stops and starts throughout the night. You may not remember waking up, but your brain never reaches deep sleep. This leads to morning headaches, memory problems, and constant exhaustion. Even if you think you slept through the night. Heart disease. Fatigue is a well-known early symptom of heart problems. If your heart isn't pumping efficiently, your muscles and brain don't get the oxygen they need. Climbing stairs, walking, even doing the laundry can start to feel like a marathon. Many seniors don't feel chest pain. They just feel tired. Thyroid problems. An underactive thyroid slows everything down. Metabolism, energy, mood, digestion. If you're gaining weight, feeling cold often, or struggling to concentrate, hypothyroidism could be the culprit. The bottom line? Persistent fatigue is not normal aging. If it's new, getting worse, or interfering with your daily life, it's time to get a simple blood panel and have a conversation with your doctor. Now let's look at a symptom that's so common, it's almost expected in older adults, but can point to issues much more serious than most people realize. Fifth, frequent urination at night. Getting up once or twice in the night to use the bathroom? That's not unusual, but 3 or more times every night is a red flag. This condition, called nocturia, is often dismissed as just part of getting older, but it can signal several hidden problems, such as uncontrolled blood sugar. One of the earliest signs of type 2 diabetes, especially in seniors, is nighttime urination. When your blood sugar is high, your kidneys try to flush it out. If you're also experiencing increased thirst or blurry vision, it's time to test your A1C. Prostate issues in men. Benign prostatic hyperplasia, or BPH, becomes more common after age 60. The enlarged prostate puts pressure on the bladder, making it harder to empty fully, which means you're up all night. This isn't just annoying. If left untreated, it can lead to urinary retention or kidney problems, overactive bladder or urinary tract dysfunction in women. Hormonal changes, muscle weakening, and even certain medications can lead to frequent nighttime trips. But many women don't talk to their doctors about it, assuming it's normal. It's not. And it's usually treatable. Heart or kidney dysfunction. Here's the big one most people don't expect. If your legs swell during the day, your body may reabsorb that fluid when you lie down, causing your kidneys to work overtime at night. This can be an early sign of congestive heart failure or kidney stress. So while nighttime urination is common, that doesn't mean it's harmless. And if it's disrupting your sleep, or paired with swelling, high blood pressure, or fatigue, it's time to look deeper. Coming up, we'll talk about one of the most dangerous signs seniors ignore: the gradual loss of balance. What seems like just old age could be your brain waving a red flag. Now let's talk about one of the quietest indicators that something might be wrong, and it's one that most seniors shrug off. 5. Loss of balance or unsteadiness. Maybe you catch yourself grabbing the countertop when you turn too quickly. Maybe your feet feel a little heavier, or you feel wobbly when walking on uneven ground. It's easy to assume this is just what happens as we age. The legs weaken, the joints get stiff. But balance issues are more than just a nuisance. They can be the first sign of serious underlying conditions. Here's what could be happening behind the scenes. Neuropathy. Peripheral neuropathy, often caused by diabetes or poor circulation, affects the nerves in your feet and legs. If your feet feel numb, tingly, or like you're walking on padding, that's not just uncomfortable, it's dangerous. Your brain can't sense the ground beneath you properly, which affects your stability. Small vessel disease or mini strokes. If your balance feels off but you're not in pain, it could be a sign of cerebral small vessel disease, where tiny blood vessels in your brain become damaged. Over time, this reduces blood flow to the parts of the brain responsible for coordination and posture. It's also a common cause of vascular dementia, Parkinson's disease, or early neurological conditions. One of the earliest signs of Parkinson's isn't tremors. It's changes in gait, stiffness, and a sense of being off balance. If your movements feel slower or you feel like you're shuffling rather than stepping, don't wait. Early intervention makes a big difference. Inner ear dysfunction. Your inner ear controls your sense of balance. Infections, fluid buildup, or structural problems can all lead to chronic unsteadiness. Many seniors go months or years without realizing it's not in their legs. It's in their ears. Medication side effects. Blood pressure meds, sedatives, painkillers, even allergy pills can cause dizziness or imbalance, especially when combined. If your balance issues started around the time your medications change, that's a strong clue. Here's why this matters. Balance issues double your risk of falling. And a fall after 60 isn't just a scrape. It can mean broken hips, lost mobility, hospitalization, and a long road back. But if you catch the warning signs early, you can treat the root cause and reduce your risk dramatically. So, let's bring it all together. These 5 symptoms: dizziness, memory lapses, unexplained fatigue, frequent nighttime urination, and loss of balance, are incredibly common in seniors, and that's exactly why they get brushed off. You might hear, that's just part of aging, or everyone over 60 deals with that. But common doesn't mean normal, and it definitely doesn't mean harmless. Each of these symptoms could be your body whispering that something's wrong. And if you ignore the whisper long enough, it may turn into a shout. But here's the good news. Most of these issues are treatable, and in many cases reversible, if caught early. So what can you do right now? First, don't downplay your symptoms. If something feels off, track it. Write it down. When it started, how often it happens, what you were doing at the time. These patterns are exactly what your doctor needs to spot what's going on beneath the surface. Second, schedule a checkup. Even if you've seen your doctor recently, make a separate appointment just to talk about your symptoms. Bring your notes. Ask for tests, blood pressure checks, blood panels, thyroid screening, vitamin levels, sleep studies, cognitive tests if needed. You're not being dramatic. You're being proactive. Third, move your body. It sounds simple, but daily movement improves nearly every issue we covered. It improves balance, strengthens your heart, boosts memory, regulates blood sugar, and increases energy. You don't have to run marathons, but just move. A 20-minute walk, some chair exercises, a light stretch. Whatever you can do, start there. And finally, advocate for yourself. No one knows your body better than you. If your concerns are dismissed, get a second opinion. If something doesn't feel right, don't wait until it becomes an emergency. You deserve to feel strong, steady, and clear-headed, not just for your age, but for your life. If this video helped you, take a moment to hit that subscribe button. We post weekly videos with honest, practical health advice made specifically for seniors. No scare tactics, no fluff, just real solutions that work. And if you've experienced any of these symptoms yourself, or caught something early because you listened to your body, tell us in the comments. Your story could be exactly what someone else needs to hear. Thanks for watching, and remember, your body is always speaking to you. You just have to listen.